in limelight. Dengue is no inferior virus. It is a flavivirus. It is by the bite of the Aedes mosquito. There was surge of cases due to climatic changes, travel habits. It can present as asymptomatic situation, but 20% develop symptoms mild to moderate, and the severe cases is called dengue hemorrhagic fever or the dengue shock syndrome. Incubation period is 7 to 10 days. It can present as fever, chill, malaise, arthralgia, headache, retroorbital pain, rash, sore throat. The severe dengue features, especially seen in diabetic patient. There is a 3-4 things which happens in the pathology of the severe dengue. There is a plasma leakage, there is a thrombocytopenia, there is a hemorrhage, and then there is a organ involvement. So it's a real tough thing to have a severe dengue feature, saying severe dengue fever. It can also present pleural effusion, ascites, hemorrhage in the skin, ecchymosis, GI hemorrhage, epistaxis, and organ dysfunction. Few common things. Hepatitis is very commonly seen in dengue. Encephalitis, myocarditis, shock due to plasma leakage, hypoperfusion, hypothermia, metabolic acidosis, and acute kidney disease. Acute kidney disease in the dengue carries very high mortality. So remember the problems of the organ dysfunction, remember the problem of the shock with the dengue and how it happens, the plasma leakage, thrombocytopenia, hemorrhage, and organ involvement. The lab diagnosis is low WBC, low platelet count, anemia, ESR, hematocrit. NS1 antigen by ELISA, IgM, IgG, and PCR. Now let me tell you one thing about hematocrit. Hematocrit can rise and hematocrit can fall at the same time. Now how these two things happen? Hematocrit rises is supposed to be one of the earliest signs of the dengue, lab-wise. Why? Because there is a plasma leakage and the hematocrit will rise. But when the complication starts, there is hemorrhage in the internal or external, then the hematocrit fall. So you have got the two things both together. Now differential diagnosis is chikungunya, influenza, malaria like this. Complication is very important. MOTS, multiple organ dysfunction syndrome. The lungs, the heart can give you pneumonia, ARDS, myocarditis, pericarditis, conduction abnormality. There can be bone marrow failure. There can be liver and kidney damage, hepatitis and acute liver failure, acute pancreatitis, acute respiratory failure, acute renal failure, hemolytic uremic syndrome. Neurological can be encephalitis, GBS, transverse myelitis, cerebral vasculitis, febrile seizures, bacterial superinfection can also be there. Prognosis, mortality overall is 2.5% if the patient is treated in ICU setup and given the treatment is only symptomatic. There is no specific treatment for dengue fever. Now Nipah virus, I will generally